Hi, everyone. I'm Emily. I'm one of the dietitians, diabetes educators here with Cecilia Health. And we just want to thank you so much for joining us this evening for our long term maintenance and emotional barriers of CKD webinar here tonight. And here at our very bottom, there is a phone number 1-800-263-6317. That is the phone number to call if you're having any technical difficulties. But thank you again for joining us.
Hold on one sec.
No, you're fine, Nancy. Thank you.
Okay.
So, just as a reminder to everyone, this is an interactive program. Tonight, our dietitian Nancy will be doing a short presentation, followed by some time for some Q&A questions. So, you will see here on your toolbar to the right, there is a tab for you to enter in any questions that you may have. So, please feel free to jot those down. And we're always open to any questions that you may have about what she discussed, or if you have any questions about anything else, maybe nutrition or anything else with CKD as well. Now, as a disclaimer, we know that the information you are about to hear may motivate you to make lifestyle changes, but please do talk to your doctor before making any changes to your current routine. The Cecilia Health registered dietitian will provide strategies to help manage your chronic kidney disease, and this online Q&A session is intended to give general advice. This information is not a substitute for personal medical advice and involves the professional opinion of the Cecilia Health RD as well. So tonight I am happy to introduce Nancy Cohen as our dietitian for tonight. She currently lives in Pennsylvania. She has her degree in nutrition and dietetics from the University of Florida and has been working in the nutrition field for over 40 years. She educates clients in all areas of medical nutrition and wellness and is happy to be a member of the Cecilia Health team. Nancy is a mom of an adult 30-year-old son, has a passion for her beautiful Weimaraner dog Dinah, and she loves to work with all of her clients online in the Cecilia Health chronic kidney disease and weight management program. She brings a positive attitude to all on ways to incorporate good nutrition into life and to make the most out of every day. So thank you all again for your time. Nancy, I'll pass it off to you. Thank you.
Well, thank you so much, Emily. Hi, everybody. I'm so happy to be here tonight doing this really interesting presentation. And if you're here live or listening from home, we're very happy to have you. So in tonight's agenda, we're going to talk about two different areas affecting CKD. One is the long-term maintenance area, working on controlling blood pressure, blood glucose, smoking cessation, weight management, and talking about preparation for dialysis. And then we will discuss some of the emotional barriers that may come up for us regarding tips for managing mental health, how to recognize anxiety and depression, some conversations about stress reduction, sexual topics, and finding support. So let's get rolling. Away we go. So long-term maintenance, which is what we're all in for, is the long term. It's really important to think about how we can maintain our health for the long term, and maintenance is very involved in that. Chronic kidney disease is something that requires lifelong maintenance to maintain good overall health. And we want to keep our blood pressure and blood glucose in range, which can help minimize damage to our arteries and kidneys. Quitting smoking is also important. It can improve the health of our lungs and our kidneys. And maintaining a healthy weight can help reduce the risk of diabetes and hypertension. And dialysis is sometimes needed when kidneys can no longer take care of the body needs. So let's look at blood pressure. High blood pressure is when the force of blood against the artery walls increases enough to cause damage. It is the second most common cause of kidney disease. There is no cure for high blood pressure, but treatment can help, including making changes to achieve a healthier lifestyle, and medication may be needed as well. On the topic of diabetes, people with diabetes and kidney disease need to see their diabetes educator at least yearly for monitoring, education, and support. Ongoing checkups and follow ups are important to prevent disease progression and detect early signs of disease complications. So, following the instructions of your doctor and working with your registered dietitian or nurse practitioner who's supporting you is very key in the diabetes area. Smoking. Well, smoking cessation is just so important. It's not only bad for your lungs, but it's also bad for your kidneys. Smoking causes disease in every organ of the body. So people who smoke are more likely to have protein in their urine, and this is a sign your kidneys are under stress. Here are some suggestions we offer you to help you to quit. Choose a date to stop. Change your environment. Let others know that you are quitting. Talk with your doctor. Ask about medications for stopping smoking. Be prepared to fight urges and identify resources to help you. So, those are some really great tips. Thank you. Okay. Weight management. So, weight management is really important when it comes to health. Excess weight increases the risk of diabetes and hypertension, which are those two major causes of chronic disease, chronic kidney disease. So before, though, starting a new diet or exercise program, always just check with your healthcare provider, see if it's all right that you do that. And here are a few tips you can apply to get you started. Log it. So keep a food and exercise log. Create an exercise plan. Make simple swaps, like look at high calorie foods you can enjoy and try switching to low calorie alternatives, like this beautiful apple on the screen. Instead of apple pie, have an apple. How delicious is that? Plan for hunger. Talk to a dietitian about healthy snack options that are low in calories and high in fiber. You know that fiber makes you feel more full. So that's the idea there. And then slow down. Eat your food more slowly. Savor your food and focus on foods that require more chewing. Because sometimes we rush with our eating and we don't even notice whether we're full or not. So give those tips a whirl. Some of us may have to prepare for dialysis. And some people with chronic kidney disease need dialysis when their kidneys can no longer take care of their bodies. You would need dialysis when you develop end stage kidney failure. And we know there are 5 stages, be the last one. Usually, by the time you lose about 85 to 90% of your kidney function and have a GFR of under 15. Dialysis removes excess waste, salt, and extra water. It also keeps a safe level of potassium, sodium, and bicarbonate in your blood and helps control blood pressure. There are 2 different types of dialysis. One is called peritoneal, and that's more of like one you can do at home, but of course you'll check that with your doctor. And hemodialysis is the kind that they put through your arm, and you usually go to a dialysis center. But they're both life-saving measures, and be open to whatever is required for your best health. So dialysis can be done in a hospital or in an outpatient office or at a home. And you and your doctor will decide which place is best for you. While dialysis will not cure kidney disease, patients needing dialysis will continue to need it unless they get a kidney transplant. So many patients live normal lives while needing dialysis treatment. You may need to be on a special diet, and of course, you would check with your healthcare provider. So now we're going to come to the second part of our conversation tonight, and that's emotional barriers. And we understand that There's a lot of stress when you're challenged with health. So it's so important to manage our mental health. Here are some things that you can do to support yourself. First one is talk. Confide in someone you trust. It could be a family member, a friend, a counselor, or someone else you can trust. And this can even help lessen the weight on your shoulders. Share. Everyone is dealing with their own unique challenges, and yours is kidney disease. Your close friends and family can be supportive even if they are working through their own situations. Don't be hard on yourself. Living with kidney disease can be stressful. You have a lot to manage. So remember to celebrate the small successes. It can be helpful to keep a gratitude journal to focus on the positive aspects of your days. Also, find a routine. For days when you aren't feeling well, have a planned routine for things that you do that you enjoy. I wonder what's on your list. I'd love to hear. Take charge. Living with kidney disease doesn't mean you should have to give up on your goals. Focus on setting realistic goals and move towards them one small step at a time. And make some me time. I don't know if I would want to wear those cucumbers and the mask, but she looks relaxed. Make some me time. It is important to set boundaries around the illness and not let it consume all your thoughts and activities. So definitely carve out some time with family and friends or time for yourself. You are so important. And sometimes we don't even realize it, but it's important for us to talk about this today. So let's work on recognizing anxiety and depression. Advanced kidney disease and depression share many of the same symptoms, including fatigue, sleep problems, poor appetite, and trouble concentrating. So it's important to discuss these symptoms with your healthcare provider to see what is causing them. These are great ideas because you might have one and the other and have someone to share that with. So let's look at some other symptoms of depression and see if we can identify them. Some symptoms of depression include difficulty doing things you typically enjoy, feelings of guilt or shame, worthlessness, hopelessness, crying, sadness or irritability, withdrawing from family or friends, and or thoughts of self-harm. So if you have any of these, please share them with someone. And primarily, I would go to my healthcare provider first, actually. So I'd like to put that in there. These are some simple tips, though, that you can practice at home for stress reduction. And I'd like to hear some of yours. Some simple ways to reduce stress include eating healthier foods, limiting your salt and caffeine, especially if you do have high blood pressure, limiting your sugar intake, especially if you have diabetes, and fats, especially if you're at risk for heart and blood vessel disease. Set aside some time to relax and practice relaxation techniques. There are many: yoga, meditation, resting, practicing breathing, and of course, you can practice prayer. So these are some really lovely tips that you can use right at home. You don't have to go anyplace fancy to do them. Some other simple ways to reduce stress include talking to a friend or loved one, a spiritual leader, or your healthcare professional. Another idea is to write down your problems and think about the best solution for each of them. A list can even help you evaluate and prioritize what issues need to be addressed. Set realistic goals and expectations. Do your best to get enough sleep and maintain a regular sleep schedule. Work on maintaining a positive attitude and outlook. There are so many things that are going well, and we just need to find them and focus on them. Go on vacation if you can, exercise regularly, or work on increasing your physical activity because they say that really helps reduce stress. So, great, great tips. Now, we have some slides on sexual function, and what we'd like to really say is that many people have questions about their sexual health, and we suggest that you have concerns, bring these to your healthcare professional. I, as a dietitian, this is not my area of expertise, so we always say, please contact your physician and talk honestly and openly with them. And for the same for pregnancy and kidney disease, if you're of the age and you're trying to get pregnant, again, your medical professional will be the greatest person to refer to. So, your sexual and fertile health belongs with those professionals that practice in that area. And finding support. Should you feel the need to find support, there are numerous online support communities and emotional lines to reach to help you, especially if you're in the house and you can't get out. So we have quite a few listed here, and maybe you can just snap a picture of them or write the ones that seem right for you. The National Alliance on Mental Health hosts online communities where people exchange support and encouragement. And here are some of the free online support resources. There's this one called Seven Cups. There's another one called Emotions Anonymous. A third one is called Support Group Central, and they also have contacts to speak about numerous mental health conditions and also have other languages. Supportgroups.com is a great resource. 18% is another one. Psych Central is another site you can reach out to. NFK Peers. I said that backwards. Did you notice that? NKF Peers is another one to speak to when you're stressed about kidney health, and NKF Cares. And then the last one is online community. So there's lots of really great resources. And again, you will have access to these slides. Once we finish the webinar, you can come back to this and view them again. I think we put it up in the next few days. So awesome. Thank you, everybody. So that is what we covered for tonight. I think this was a really important webinar. You know, as a clinical dietitian and having worked with so many of you in the chronic kidney disease area, you know, you're so great about following your nutrition and following your food plan, but we can't ignore the stress. It's really there. So just remember to take just the best care of yourself you possibly can. Find someone to speak to. Check in with your doctor if you have questions. And I thank you for letting me present to you tonight. Does anybody have any questions on anything we covered? Okay, then. Then, Emily, I'm going to turn back over to you.
Perfect. Thank you so much, Nancy.
Oh, my
Um,
pleasure.
And just like Nancy said, there was a lot of topics that were discussed tonight. And the idea is we just want you to be thinking of how so many different parts of your body, so many different parts of your day to day can be affected by your health as well. So we want to make sure you're having those conversations with your doctor. Here coming up, we do have in November a webinar that's diabetes and CKD presented by one of our diabetes educators. And in December, we do have a management of chronic kidney disease webinar as well. As always, you can check out our Facebook page or also talk to your health coach that you are working with as well if you have any additional questions. But we just want to thank you again for joining us tonight and have a great rest of your evening. Thank you. Bye bye.
Bye, everybody. Thank you.